Holy smokes, guys. Joey Gilbert here. Just got done. It has been an unbelievable day. First of all, we start off this morning with the Washoe County Commission voting 5-1 to file an amicus brief in support of my lawsuit that is just now freshly file stamped. It's been accepted. We are suing Governor Sisolak and the Pharmacy Board and the State of Nevada Chief Medical Officer for this, what I believe is an illegal emergency regulation limiting the use of hydroxychloroquine for those that are positive with the coronavirus. Again, guys, this has been something I've been working on for about 2 or 3 weeks now. Actually, the governor put a ban in place March 23rd, so we're almost on a month here. And for those of you that don't know, both my mother and father tested positive for the coronavirus, and it was this medication that saved their life. So when people say, how do I know? I know. All right, I don't need to hear any more bullshit. I don't need to hear any more about the anecdotal evidence. I watched it with my own 2 eyes. I watched my father go from a 103 fever to 98 and no headache, and watched my mother look like she was near death to being a normal person 6 or 7 hours later. So at the end of the day, guys, this medicine, it doesn't work for everyone. Not everybody needs it. There's plenty of people that are healthy. This isn't going to touch them. But for our high-risk population, our older folks, those with respiratory illnesses, those with chronic medical conditions, autoimmune disorders, those people need to have access to this medication right away when things go bad. And they're showing, and what we found out today at the county commission meeting is that that emergency managers and those that we've trusted with this position in the state have recommended to the governor and to the Department of Public Safety that anybody that tests positive for the coronavirus should have access to this medicine as quickly as possible. It's called the therapeutic use window. If you don't get this medicine in early, the patient can deteriorate, and what happens? This is a very different, first of all, it was made in the laboratory, so I hate to ruin it. It was made in Wuhan, China. It is the Chinese coronavirus, 100%. It was made in China. It came from Wuhan. It was designed in a laboratory. There you go. Now, that being said, this little virus, this coronavirus, attacks the hemoglobin. And when it attacks the hemoglobin, it lets out the iron ion. Without the iron ion, the hemoglobin cannot transport oxygen. So it's just running around, wreaking havoc, not able to deliver O2 to the villi, the little sacs. There's no exchange taking place. So what happens? People are essentially suffocating. They're not getting oxygen, and they go into organ failure. This isn't your classic ARD scenario. Okay, this is a totally different deal, and they figured it out that it's a blood deal, and just like it's the same thing that happens with malaria, the same thing happens with coronavirus. For some reason, a reason I don't know, hydroxychloroquine breaches or is able to permeate the cell barrier and bring zinc in with it. And it's actually the zinc that prevents the coronavirus from growing, from multiplying, okay? And if it can't duplicate, it can't multiply, it dies, it goes away, right? So at the end of the day, guys, this is an important step. It's not something I wanted to do. I've worked hard with the pharmacy board. I've worked hard with the proper channels that I could. I've done everything I can. This was a last resort. This is a 68-page complaint asking for emergency declaratory relief. And I am absolutely confident that once this gets into a courtroom here in Northern Nevada, a patient and doctor's relationship is a sacred relationship. No one should be telling a doctor that he doesn't have a right to treat a patient of his that he's had for 10 or 15 years. No one knows Mrs. Smith's medical condition better than her doctor, her practitioner, her family practitioner. And if she wants to have him prescribe a medication that has been authorized under an emergency use authorization by the FDA, then she should have access to that, or he should have access to it. And if one of our firemen or law enforcement or healthcare workers or first responders contracts the coronavirus, then they should be able to have access to this medication immediately and not have to wait till they're brought in as an inpatient. That's insane. This is America, Jack. And if you catch a communicable disease, then you're allowed and you should be able to use any treatment necessary and any treatment that your doctor prescribes for you. So again, look it up. I've been telling people this for a long time now. There is so much information out there. Go look up this lady right here, Dr. Jill. Go look up Dr. Jill and read about the emerging theories that may help us solve the COVID-19 puzzle. All right? And another thing you could do is go to www.covid19 Nevada Strong. That is a website I have put up. It's to share information, resources, and let you tell me your story. If you have something you can share with us that you think you can help us with, please share it. If you or a loved one or a family member were hurt or were not allowed to receive the medical treatment you needed or the medicine you needed and something bad happened, I want to know, because I'm going to take it right to the governor. All right? At the end of the day, guys, listen, no one is saying you have to use hydroxychloroquine, okay? For you haters out there and you people that have Trump derangement syndrome or whatever you got, you don't have to use this, all right? I know it said 18% of Democrats would not, only 18% would use it. That's just silly. If you have access to a medication that's going to save your life, you might want to use it. You might want to give it a try. Because if you end up on a ventilator, you got about a 20% chance of making it off. And here's the best part, lung problems for life. So we do not want people waiting till they can't breathe to have to go to the hospital and be admitted to the hospital to get this medication. If you have a positive coronavirus test or you've got progressed symptoms for coronavirus and have been exposed to positive coronavirus patients, then you should be on this medicine. And once we build our supply chain back up, then we can start treating prophylactically, which means in advance, getting our law enforcement, getting our fire, getting our first responders and healthcare workers on it. But right now, if you test positive for the coronavirus, the only thing you can do is wait until you're sick enough to go to the ER. And I'm sorry, but that's not how it works. And that's not how it's going to work. So one more time for everybody who's been paying attention to all I've been doing, this is the coronavirus medication fight. And if you want access to hydroxychloroquine, then you should have it. And all I'm going to tell you people out there that want to talk all the crap you're talking and get on my page and take shots at me, first of all, number one, I can handle it, and you don't faze me, and it ain't going to bother me one bit. I'm not here to make friends. I'm here to save lives. At the end of the day, I've watched it with my own two eyes. I've heard stories from across the country. I've talked to doctors in New York, Michigan, California, Florida, and even had correspondence with people overseas. And hydroxychloroquine works. I don't know why it works. That's not my job. My job is to make sure that you have access to it if you need it. So, again, for everybody paying attention, if you have access to the governor, if you have access to our political leaders, and anybody in a position of power, I need you to start jawing in their ear that we need this stupid emergency regulation banning hydroxychloroquine and chloroquine gone. It was a knee-jerk political reaction. They never had a count on the meds. They didn't know the pill count when they made it. There's no way they could have had that pill count. They tried to retroactively go get it. But guess what? No emergency ever existed. No one was ever without medicine for their lupus or their rheumatoid arthritis. Not to mention the fact that those people can use other drugs. This is a crisis. This is a pandemic. We needed access to this medicine now, not sitting and rotting on our shelves till July 23rd, Governor. All right? At the end of the day, there's medicine expiring right now in this state. Should be handed out to fire stations. Should be handed out to the homeless centers. Should be handed out to the adult care living facilities that are getting decimated right now. Because once it hits one of them, it hits all of them. And for those people that are asymptomatic but are around positive coronavirus patients, they should probably be using this immediately. Again, I was told by the state there was a supply issue. I personally contacted the manufacturers. I personally contacted the suppliers. And I personally contacted the pharmacies in town. And I was all told the same thing. The only reason we have this supply problem right now is because of Governor Sisolak's ridiculous emergency regulation limiting and banning the use of it. So let's get back in the game. Let's hit hard. Let's keep punching. The only way to beat this thing, to knock this curve down and get our damn casinos open and our small businesses open and in agreement with Mayor Goodman down in Las Vegas, this is insanity. When you're in a fight, you hit hard. You go to war with what you got. And what we got is the most efficient, effective treatment known so far, and it's called hydroxychloroquine. So let's get it in mass. Let's get it to the homeless centers. Let's get it to the adult care and living facilities and veteran housing. And any place we got a hot spot, let's get this hydroxychloroquine with the zinc, okay, with the azithromycin. If you got a heart condition, you use doxycycline. And if you got a heart condition, you can cycle it. You can piggyback it. You can do the hydroxychloroquine first and then go to the antibiotic. But again, I'm not a doctor. I'm not a board certified physician. I'm just a really passionate, very excited, very emotional Nevadan who doesn't like finding out that people that need access to this medicine don't have it. So there you go. At the end of the day, we did what we said we were going to do, and that's what you're supposed to do. All right? You do what you say you're going to do. And Governor Sisolak is charged with protecting all the lives of all Nevadans, not limiting or banning a medication and telling you that only when you're sick enough and you can't breathe do you show up at an ER and get put on a ventilator where you have a 20% chance of surviving and a 95% chance of lung problems for the rest of your life. So again, if you don't know about the coronavirus, get online, search up this little Dr. Jill, read about the emerging theories behind the coronavirus, and learn that the ventilation option ain't an option at all. It's a death sentence. We need people to use hydroxychloroquine as early in the cycle as possible, meaning as soon as they've been diagnosed. And with some people, you don't know when that window is. With your older 81-year-old patient that's had respiratory problems in the past, day one could be the day. You understand that? You can't tell some lady that she's got coronavirus and to go wait it out at home. I mean, are you shitting me? Is this Nevada? Are we battle-born? Yes, we are. So we're going to keep fighting, and we're going to get this medicine approved, and we're going to get this ridiculous ban thrown out and get people access to hydroxychloroquine if they have a positive test or if they've got progressed symptoms and their health care provider, their doctor, their practitioner prescribes it to them because that's their right. That's their constitutional right to practice medicine. Something a pharmacy board doesn't have, something a governor doesn't have, and something a chief medical officer that's not an MD doesn't have. So from the bottom of my heart, I want everyone to know that this is not a political issue to me at all. This is a Nevada issue. We are Nevada strong. I will always be fighting for Nevadans as long as I live. This community and this state has given me everything. Las Vegas, I love you. I spent 5 years living down there on Henderson on Stephanie in the 215. I got a foreclosure down there, by the way. That sucked. 2008 back in the day, but we're back. We've risen like the phoenix, right? And we're here to do good, and we're here to make sure that all Nevadans are treated fairly, because at the end of the day, if you don't have a primary care physician, you don't have medical insurance, you don't have anywhere to go, what are you going to do? You get a positive coronavirus test, who are you supposed to call, right? If you're not here in this country legally, or if your papers aren't fixed, but you're a good, upstanding, productive member of this community, I'm going to tell you to go home and wait. That's not how this works. Every person in this state, in the state of Nevada, that has a need for hydroxychloroquine and has a positive test for the coronavirus should have access to this medicine. I don't care how you do it. Just do it. That's your job. Right? At the end of the day, make sure people have access to this medication so they don't die. And no one should be forced and sent home and allowed to deteriorate to such a state that they have to show up to the ER and be put on a ventilator. Because there's going to be liability and culpability there. I'm telling you now. And at the end of the day, I'm your huckleberry. To take this fight as far as it needs to go, that's what we're here for. So I'm signing off so I can go home, get out of this suit, hit the Peloton, and get my miles in. Because this has been a day, we're always going to work, we're always going to put in our time, we're always going to move the chains. And I see people popping up in here that I've known my whole life, I've known since college. You know me, you know why I'm doing this. I'm doing this because I saw a wrong, and we're going to make it right. All right? At the end of the day, guys, what's right is right, and what's wrong is wrong. And not allowing Nevadans to have access to a life-saving medication because of a knee-jerk political reaction, that's garbage. We don't play that here. Okay, I don't care where you're from, who you're at, what political party you align with. I just want to make sure you have the medication you need so that you can live, and that the people that you care about and you love, they can live as well. This is Joey Gilbert signing off. It's been a long day. Started with the county commission meeting. Thank you to everybody today that voted to file an amicus brief in support of my lawsuit. I think we are going to be good to go. I think once this thing gets in there, and with the information we provided, we're going to win this thing. But again, we'll stay in this fight as long as we need to. And I just want to say thank you to everyone who's helped me. You all know I'm not the smartest, tool in the shed, all right? But I got the smartest lawyers and the smartest friends and the smartest guys and gals backing me up like they always do. And I just want to say thank you. Nevada, you should be profoundly grateful for the public servants that have been assisting me in the shadows. And some of them, they're right there next to these people that are not paying attention. And so I just want to say thank you for the courage. Thank you for the cojones and for the Just the love, man. At the end of the day, this is about love. This is about protecting Nevadans, and this is about doing what's right. So Governor Sisolak, please, man, at the end of the day, all respect, all honor aside, this was not to do anything other than ask you to please right or wrong. And so I'm asking you to fix this. I'm asking you to tell your people to greenlight this. Supply chain is good to go, and it will be better once this ban is gone. You got to trust that. I have found out that your ban did the absolute opposite of what you thought. The suppliers directed their medicine elsewhere. Does that make sense? It's always about the money. All right? Right? It's always about the money. You're going to send medicine to sit on store shelves till July 23rd, or you're going to ship it out so you can make money off it. That's a no-brainer. But I do know this. Up in Utah, they have excess hydroxychloroquine. Up there in Utah, in the Walgreens up there, they got extra hydroxychloroquine. And guess what? They can send it right down here like that. Only problem is there's a ban in place by our governor. So governor, fix it. Let's get it done. Let's get people the medicine they need. And let's take care of the soldiers and the people on the front line. And those are our healthcare workers, our first responders, our fire, and our police. All right? Back them. If you don't want to back me, back them. Get these people the medicine they need, and get anybody with a positive coronavirus test the medicine they deserve, so they don't have to be scared out of their life and worried about, infecting other people. And here's the last thing that's important. I said this earlier on, but one of the main reasons you want to be put on hydroxychloroquine early is not only will it stop the symptoms from progressing, it'll slow the infection. All right? Everybody's talking about knocking the curve flat. Everybody that has a positive test should be on hydroxychloroquine. All right? Because that's how you slow the spread. That's how you stop the spread. That's how you get our casinos open. That's how you get our small businesses back in gear and everybody going again. And all right, for those of you who are afraid, stay your ass at home. All right? If you got a problem, you're scared, stay at home and wait for the government to solve your problems. I ain't waiting for that. We're problem solvers. We're private business. This is what we do. And let me say this. The pharmacies and the doctors, they know how to treat their patients. The pharmacies already had a plan in place to move meds around, to contact the lupus and arthritis patients and see if they needed their medication or they could wait 30 days. And guess what they found out? An overwhelmingly amount of them were willing to do that or didn't need a refill. How about that? Did we try that first before we banned a medication that works? No, we didn't. And now we're going to have to go about it the hard way, but I'm going to ask the governor politely, respectfully, please, Governor Sisolak, rescind your emergency regulation or amend it to allow all positive coronavirus patients to receive this medication if and when their doctor believes it's the right treatment for them. Let's leave it to the doctor and the patient. That's a sacred right, a sacred relationship, and they're the best ones to know when and if this medication should be used. Don't make them go to a crowded infectious ER and put our already tapped healthcare workers in worse problems, all right? This is Joey Gilbert saying I'm done and I'm out of here. I love y'all and I appreciate everybody's support. But the saga continues, man. I don't think it's over. But hey, you know what? Maybe the governor is a reasonable man. Love y'all. See you.